Criminalization of young people with complex support needs. Introduction. According to some critics, mental and cognitive isolation and discrimination are commonplace in juvenile justice systems. No one cares about how young people with disabilities are treated differently in prison. The Competitive Juvenile Penalization Program, a critical cross-jurisdictional study of the juvenile justice system and penalty in the United Kingdom and Australia, will fill this void. The use of current disability analysis and critical criminology in youth justice systems around the country is being scrutinized for its treatment of socioeconomically disadvantaged youngsters with various impairments. Evidence-based practice. EBP will explore how evidence-based medicine might benefit people disadvantaged by poverty, racism, aging, sexuality, and psychiatric disorders, among other factors. This course covers a wide range of subjects related to evidence-based medicine and evidence-based practice. Researchers discover that evidence-based medicine, EBM, concentrates on the biological and individualistic components of health while neglecting the importance of social and cultural factors. Those who suffer the most severe burdens of sickness are alienated by a lack of relevant research, restricted treatment options, and a focus on activities that have the potential to affect their health dramatically negatively. These are the three fundamental steps in the knowledge transfer paradigm that must be completed. It is the act of gathering and synthesizing information. It is also the process of disseminating information. The acceptance and implementation of the strategy by the organization. Patient safety portfolio. These processes of knowledge transmission are first seen from the standpoint of how research findings from the patient safety portfolio or specific initiatives are distributed. From the research comes the following conclusions. People with disabilities and those who are disadvantaged are stigmatized and criminalized. Children and adolescents with disabilities are handled by youth justice agencies differently. Early and holistic solutions are critical for newborns and adolescents with complex support requirements. The lack of community resources contributes to discrimination. Youth courts and juvenile courts. Social and economic hardship are common in Australia's juvenile courts. Among young people who have been involved in youth justice systems, alcohol and drug misuse has disrupted or ended education, and periods of poverty and homelessness are common. Out-of-home care placements are prevalent for juveniles who enter the juvenile court system because of various traumatizing experiences, including assault and abuse. Since they are linked with diverse degrees of mental health problems and cognitive impairment situations, these various causes can collect and connect to generate complex support requirements when early intervention is not provided. Based on practical research, children in out-of-home care are likely to be involved in the criminal justice system. Healthcare, evidence-based practices, and judicial system results. Based on the degree of seriousness, short-term and long-term effects of mental illness include anxiety, panic attacks, hallucinations, and other delusions. Dementia and the FASD, fetal alcohol spectrum disorders spectrum, are examples of cognitive impairment. Reading and listening comprehension are impossible for people with learning disabilities because of their inability to understand what is being said. When confronted with a stressful or dangerous circumstance, one or more of these conditions may lead a person to lose control of their behavior, act erratically, or both. This crew will be in the hands of the courts for the rest of their lives without any serious help from the police. Children with exceptional needs are criminalized rather than helped by a convoluted judicial system. Many times, the question of ensuring that all people have equitable access to healthcare services. Although healthcare costs are not always allocated equally throughout communities, those who need it most do not always have access to it. The overall fairness of a situation that is already challenging will be improved by introducing evidence-based treatment. As previously indicated by the Department of Family and Community Services, this implicit commitment might take at least two forms. Standard approaches used in EBM promote impartiality by eliminating individual judgments and inherent biases. Results from EBM may promote the efficient distribution of relevant solutions across the population on an individual and a collective level by implementing evidence-based practice and using scientific proof in healthcare policy and purchasing decisions. Results. Governmental programs should focus on creating child protection agencies that will be devoted to overcoming the problem of criminalization of out-of-home care children. Conclusions. No data suggests that Australians' concerns about the high number of children from low-income families ending up in the juvenile justice system affect its current flow. Even though the UK and Australia are incredibly similar, there are several good reasons to believe that Australia has a higher level of recognition than the UK. Indigenous Australian children and adolescents with complex needs are more likely to become victims of teen delinquency due to federally financed research efforts. Successive Australian governments have criminalised Indigenous children with unmet care requirements for decades. Based on the practical research, children in out-of-home care are likely to be involved in the criminal justice system.